Tonight, Target 12 uncovers a possible dispatch danger. It's a story we've been tracking for months. A new policy that could cause a serious delay in a situation where every second matters.
911 dispatchers in Providence are now asked to screen calls and decide if an ambulance is needed. In the past, they were just sent automatically. Tonight, a local family affected by the policy speaks out. Eyewitness News reporter Steve Nielsen has this Target 12 investigation.
It's been just 5 months since Providence changed its dispatch policy for ambulances, and already we've uncovered cases where minutes ticked away as someone fought for his or her life. 72-year-old Maria Santo needed help. Her husband tells us he called 911 saying Maria had chest pains, worried his wife was having a heart attack. Eyewitness News obtained this service report for the incident. At 7:06 a.m., the family calls for help. Based on the conversation, the dispatcher sends a fire engine with EMTs, but no ambulance. 7:07, the fire truck arrives. By 7:12, 6 minutes later, first responders decide an ambulance is needed to take Maria to the hospital. After 6 extra minutes of a 72-year-old woman enduring chest pains, the ambulance is finally sent. It arrives on scene at 7:21, 15 minutes after the initial call for help.
That's not right. I don't feel that's right. They gotta send it right away, because that can save her life.
We tracked down Maria's son, Noel, who spoke to us about the new city policy that affected his mom.
You think they should just send an ambulance right away if someone's suffering chest pains?
Yeah, right away. If it's older people, they gotta send the ambulance right away.
Providence used to send an ambulance and fire truck to every medical emergency call, but officials tell us that changed last December to avoid paying for mutual aid from other cities. Now 911 dispatchers are asked to decide if an ambulance is needed right away. If not, only the fire truck responds. Those firefighters can then call for an ambulance if the situation is serious enough. But as Maria's case shows, several precious minutes could have passed by then.
They gotta send the ambulance first if it's somebody sick.
No matter what the cost.
That's why you pay tax in the city.
I spoke with Public Safety Commissioner Stephen Perry, who's spearheaded the change in policy.
We have people there within 4 minutes. Maybe not a rescue to transport, but people there to take vitals.
Perry says it's a process and says there's already been changes made to the policy because of cases like Maria's and others. He also stresses the importance callers play in an emergency.
It's their responsibility to tell us what their conditions are. So if they have a severe chest pain, we need to know that.
He even tells us the new system could be safer than before because ambulances will be sent to fewer non-emergencies.
This is safer than what we're doing because our 6 rescues were pretty much tied up constantly because the motto was if you call, we'll haul.
Noel's mom turned out to be just fine, and he's grateful. But he says the system needs to be looked at.
There's a system with the city. They gotta figure out what is the problem. You know, they can save people's life.
Commissioner Perry points out that other cities have adopted similar policies. And he also tells me that dispatchers are already trained to triage callers. But since the change in policy, there's been no additional training. Steve Nielsen, Eyewitness News.
This investigation continues online. Read the new dispatch policy for yourself and track our continuing coverage of the controversial changes since we first brought them to you last year. It's all on WPRI.com.